How much fluid do children lose without noticing during illness? Imagine your child is feeling under the weather, maybe with a fever or tummy ache, but you don't see any obvious signs of dehydration. How much fluid could they be losing without you realizing? This is a common concern because children are especially vulnerable to dehydration, and much of their fluid loss can happen quietly before any clear symptoms show up. Children's bodies are mostly water, about 70% in infants and around 65% in older kids. This water is vital for keeping their organs working properly. Normally, children lose water through urination, sweating, breathing, and bowel movements. When they're sick, these losses can increase, especially if they have diarrhea, vomiting, or a fever. But the tricky part is that some of these losses are insensible, meaning they happen without obvious signs. For example, water evaporates from the skin and lungs even when you don't see it. During illness, children can lose a significant amount of fluid before you notice anything unusual. Mild dehydration, which is less than 5% of their body weight in infants or less than 3% in older children, often doesn't cause obvious symptoms. You might see just a slight decrease in urine output or a little more thirst. But by the time you notice dry lips, sunken eyes, or less skin elasticity, your child could already be moderately dehydrated, losing around 5 to 10% of their body weight. This level of dehydration can be dangerous because it can develop quickly in children. The reason this is so important is that children, especially infants, have smaller bodies, so losing even a small amount of fluid can have a big impact. For example, losing just a few ounces of fluid can be a large percentage of their total water content. That's why early signs are subtle and easy to miss. If dehydration progresses, it can cause serious problems, including weakness, confusion, or even shock in severe cases. At home, caregivers should watch for tiny clues that your child might be losing too much fluid. These include fewer wet diapers in infants, less interest in drinking, feeling more tired or irritable, or having a dry mouth and lips. Offering small, frequent sips of oral rehydration solutions or fluids recommended by your healthcare provider can help prevent dehydration from getting worse. If your child refuses fluids, shows signs of moderate dehydration, or has underlying health issues, it's important to seek medical advice promptly. In summary, children can lose up to 5% of their body weight in fluids during illness without obvious signs. This means that even if your child looks okay, they might be quietly dehydrating. Because early signs are subtle, proactive care and close monitoring are essential. Always pay attention to changes in behavior, urine output, and hydration status, and consult a healthcare professional if you're worried. Remember, catching dehydration early and providing the right fluids can make a big difference in keeping your child safe and healthy during illness.